The Aliveness Project is a community center by and for people living with HIV. And our mission is to connect people living with HIV to resources to live healthy, self-empowered lives. The Aliveness Project provides an array of programs and services for the HIV community, including food, hot meals, food shelf, supportive services, including case management, medical nutrition therapy, and other services to keep people living with HIV healthy.
When you come to the Aliveness Project, you see the most diverse cross-section of humanity imaginable. HIV doesn't discriminate, and anyone can acquire HIV. However, certain communities and individuals are disproportionately impacted, and typically it's communities that already experience disadvantage in society because it sets up a vulnerability to HIV. And so that's why Aliveness exists, to help people not just to take care of their HIV health, but to take care of the other life issues and barriers that prevent someone from being able to prioritize their health.
I wish we could not isolate or look at people living with HIV as being different just because of a disease. They are humans, they have full life. It's a work that I'm dedicated to, and I work at Aliveness to contribute, to make a difference, and hopefully just change even one life.
I've been involved with the Aliveness Project for probably 20 plus years. I've been there as a volunteer, and of course I've been a contributor. You're making an investment in the community, the person, and really you're doing an investment for yourself, that you're really helping people, and they need that support. I think that when you make an investment, you make a contribution to an organization, you find out what are they doing now, and where do you see them in the future. And I see them working in the HIV/AIDS community until it's gone. A mentor of mine, Harvey Milk, he said, hope is never silent.
In recent years, they discovered that when folks living with HIV take medication, it's impossible to transmit HIV. And so when we're working with individuals to build stability in life and to get medical care and medication, it not only benefits that individual, but it prevents new cases of HIV. If everyone could access the testing and care that they need, HIV would be phased out and become a thing of the past.
I believe that we can get to an end of AIDS in Minnesota, and I want to do everything that I can to help lead us to that day, as well as everything that I can to support people living with HIV and helping empower them to live the lives that they most desire.
It's fulfilling working alongside people who are passionate, staff and volunteers, people who care about each other. It's those moments that you make somebody smile. It's those moments that you make somebody, you recognize something in a person. It makes the work, light and pleasant.
Almost every day, someone in Minnesota is newly infected with HIV, and it doesn't need to be that way. That we can get to a day of no new HIV infections in Minnesota, and they can join us in that fight by volunteering at Aliveness, by supporting us with a contribution, by telling their friends and family to get an HIV test and to know their status. There are easy things that we can do to continue to stop new infections and ensure that everyone living with HIV lives long and healthy lives.